Hey guys, this is Dr. Hub. Today we are going to look at the arsenic poisoning. So under arsenic poisoning, what do we have? So there is the source of exposure. So first we are going to see the source of exposure. This will be the arsenic containing pesticide. So the arsenic containing pesticides. Next is the natural sources. Natural sources, that is, it includes the drinking water and the soil. So the drinking water plus the soil as well. So how is the route of absorption? Route of absorption will be by the GI tract. Next comes the MOA, mechanism of action. It binds to what? The sulfhydryl group. It binds to the sulfhydryl group and it inhibits. So what does it inhibit? It inhibits the pyruvate dehydrogenase. Next, the gluconeogenesis. Let's write it in full. So it inhibits the pyruvate dehydrogenase. So inhibits pyruvate dehydrogenase. Next is the gluconeogenesis. Then comes the glutathione metabolism. So what are the characteristic findings of arsenic? So there is a beautiful mnemonic, that is arsenic itself. A is for the Aldrich mesaline. Next comes R. R stands for the raindrop. So there is raindrop pigmentation and there is rash. There is also red velvety mucosa. There is red velvety mucosa which can be seen. So next comes S. S is for the subendocardial. So the subendocardial hemorrhage. And then comes E. So what is E? E is for the excessive pigmentation. Excessive pigmentation, that is the black foot disease. So let's recap. Aldrich mesaline, raindrop pigmentation, rash, red velvety mucosa, subendocardial hemorrhage, as well as the X pigment black foot disease. The excessive pigmentation. Next, arsenic. So N is next. So under N we have the neuritis. So there is neuritis. Then comes I. What is I? I is for the iron oxide plus BAL. It is the treatment. Iron oxide plus BAL is the treatment. Then C stands for the cholera-like illness. Cholera-like illness. So how do you diagnose this? The diagnosis is by a 24-hour urine arsenic. Then comes treatment. So how is the treatment done? The treatment in this case is by the BAL and it is succimer. The succimer, that is the TMSA. So now we are going to look at each system and see what are the changes in case of the acute as well as in case of chronic. So first let's start off with the skin. So first is we look at the skin. So in terms of the skin there is acute. So first let's just look at acute. So in acute, the skin, it shows delayed hair loss. This delayed hair loss, that is alopecia. Next, we look at nails. This is all in case of acute. Nails, they show mesaline. There is mesaline. This will be 2 to 3 weeks post ingestion. So when does mesaline appear? It appears after 2 to 3 weeks of post ingestion. Next is the neurologic. So in neurologic, it includes the hyperpyrexia. Next involves the convulsions as well as the tremors and the coma. Next is we look at the GI. So under GI, it includes the abdominal pain. Then comes the dysphagia and there is also the vomiting. There is bloody or rice water diarrhea. There is presence of we left out with the rice water diarrhea. So there is rice water diarrhea. Next comes the mucosal erosions. There is mucosal erosions. So this was about the acute. Next we look at the liver. So in terms of liver, it includes the fatty infiltration. So there is presence of the fatty infiltration. And then comes the kidney. So the kidney, there is the tubular as well as the glomerular changes. So tubular and glomerular changes, that is, there is oliguria, and there is also the uremia, oliguria and the uremia. Next is hematological. There is hematologic. So what is present under hematologic? There is thrombocytopenia. There is thrombocytopenia. There is impaired folate metabolism. There is impaired folate metabolism. Next, we look at the cardiovascular. So under the CVS cardiovascular system, there is the ST wave abnormalities. There is ST wave abnormalities. Next comes the prolonged. There is prolonged QT interval. And there is also the ventricular fibrillation. There is ventricular fibrillation. Then comes the atypical ventricular tachycardia. There is also the atypical ventricular tachycardia. Next is looking at the reproductive system. So under the reproductive system, it includes, there is a maternal ingestion, and this will be of inorganic, and the arsenic, it crosses the placental barrier. The arsenic, if you see, it crosses the placental barrier. Arsenic crosses the placental barrier, as well as there is the infant death shortly after birth, as well as the infant death, and this will occur shortly after death, shortly after the birth. So this was all about the acute poisoning. So now let's see the systemic wise, the chronic. So in acute, we saw compared to the hair, the skin, that is alopecia, whereas in chronic there is melanosis. There also can be the Bowen's disease. There is melanosis, there is Bowen's disease. There can also be facial edema. The facial edema can be present. There is hyperkeratosis, as well as presence of cutaneous cancer and hypercutaneous cancer, as well as the hyperpigmentation. Next, looking at nails, it is the same. In chronic, there is presence of the Mees line. So what about the neurologic? So under neurologic, there can be encephalopathy, there is polyneuropathy, and there is also the presence of tremors and the axonal degeneration. So then we move on to the GI. So what is present in the GI? There is nausea, vomiting, there is diarrhea, as well as there is anorexia and weight loss. Now we move on to the liver. So in the liver, what we have? In the liver, there is the hepatomegaly, as well as there is jaundice and cirrhosis. Now kidney. In kidney, there are some nephritic findings. And what about the hematological? Under hematological, there is a bone marrow hypoplasia. There is bone marrow hypoplasia, as well as presence of anemia. Next, there is also the leukopenia. There is leukopenia. Then comes the basophilic stippling, as well as there is karyohexis. karyoresis. Then we move on to the cardiovascular. Cardiovascular, there is a platelet activation. There is platelet activation, as well as there is hypercoagulability. And this is of the blood in the peripheral arteries. This is about the blood in the peripheral arteries, and this leads to nothing but the black foot disease. It leads to the black foot disease. So this was all about the arsenic poisoning. To learn and grow daily like this, please do subscribe.